Welcome to today's video. Whether you're a parent, a medical student, or a healthcare provider, this guide will give you a clear, complete understanding of juvenile idiopathic arthritis. I'm Dr. Rezaian, a specialist in arthritis and rheumatology. Before we begin, please remember, this video is for education and inspiration only. It's not medical advice. Always consult a qualified healthcare professional for personal medical concerns, and double-check information with trusted sources. Let's get started. Juvenile Idiopathic Arthritis, or JIA, is a chronic autoimmune disease that causes joint inflammation in children under 16. It's called idiopathic because we don't fully understand the cause, but the immune system is the main player. JIA isn't one condition. It's an umbrella term for 7 different subtypes, each with unique traits. Oligoarticular JIA affects 4 or fewer joints and typically appears in young girls. It can be subtle, but it's strongly linked to uveitis, an eye inflammation that can silently impair vision. Polyarticular J affects 5 or more joints and has 2 types, RF negative and RF positive. RF positive resembles adult rheumatoid arthritis and often involves symmetrical joint pain. Systemic JIA, also known as Still's disease, is marked by high spiking fevers, a salmon pink rash, swollen lymph nodes, and sometimes inflammation of the heart or lungs. Enthesitis-related arthritis often affects teenage boys and targets the spots where tendons insert into bones. It can also involve the sacroiliac joints and spine. Psoriatic JIA features joint pain along with psoriasis or a family history of psoriasis. Common signs include dactylitis, swelling of entire fingers or toes, and nail pitting. Undifferentiated JIA is the diagnosis when symptoms don't clearly match a single subtype. In JIA, the immune system misfires and attacks healthy joints, leading to swelling, stiffness, and pain, especially in the mornings or after naps. Diagnosing JIA starts with a careful clinical history and physical exam. We look for joint swelling, range of motion limitations, and morning stiffness. Laboratory tests help us support the diagnosis. These include inflammatory markers like ESR and CRP, and autoantibodies like ANA, RF, and HLA-B27. Eye exams are essential, especially in young girls who are ANA positive, to detect asymptomatic uveitis early. Imaging studies such as X-rays, ultrasounds, or MRIs are used to assess joint damage and exclude other causes. One serious complication of systemic JIA is Macrophage Activation Syndrome, or MAS. It's a rare but life-threatening hyperinflammatory state. MAS presents with persistent high fevers, liver dysfunction, low blood counts, coagulopathy, and elevated ferritin. Prompt recognition and aggressive treatment can be life-saving. Treatment of JIA is multifaceted and aims for remission. We often begin with NSAIDs to relieve pain and stiffness. If symptoms persist, we introduce DMARDs like Methotrexate, which has decades of proven effectiveness but requires regular monitoring. Biologic therapies have transformed outcomes for JIA. Agents like etanercept, adalimumab, and tocilizumab target specific inflammatory pathways and are used when methotrexate is inadequate or poorly tolerated. Systemic JIA and MAS often require IL-1 blockers like anakinra or IL-6 blockers like tocilizumab. Corticosteroids are used cautiously, administered orally, intraarticularly, or intravenously during flares. Tafasitamab, known as Xeljanz, and upadacitinib, marketed as Rinvoq, are JAK inhibitors. They work by interrupting intracellular signaling involved in inflammation and can be used when other therapies fail or aren't tolerated. Secukinumab, or Cosentyx, is an IL-17A inhibitor approved for enthesitis-related arthritis and psoriatic arthritis. But medication is just part of the approach. Comprehensive care includes physical and occupational therapy, ophthalmology follow-up, routine growth and development monitoring, and psychosocial support. Thanks to earlier diagnosis and advanced therapies, most children with JIA now achieve remission or low disease activity. Many lead normal, active lives with proper treatment and regular follow-up.